This is my great honor to have my invited speakers here. Okay. And today I would like to talk about VR and the holograms in operative room. Oh, I'm sorry. Could I? There it goes. Oh, sure. Okay. Here. Laparoscopic surgery provides a limited field of view, thus requiring a high degree of spatial awareness and orientation. And however, there is limitations of 2D monitor, right? The disadvantage of 3D imaging displayed on the 2D screen is limited in depth appreciation. Lack of spatial recognition due to a planar view of laparoscopic surgery makes it difficult to improve surgical skills and avoid misunderstanding. So the 3D endoscopic is now available for clinical usage. A 3D stereoscopic picture where the left and right eye images are superimposed. Our brain fuses double images in real life into one. And we can integrate it to the 3D stereoscopic medical imaging by the CAT scan or MRI. By using the Ozarix or Unity system, poor spatial perception affects how we focus and understand our bodies, the relationship to the surgical environment, such as the devices and patient anatomy and operative field. So we developed an integrated surgical navigation system of patient-based immersive extended reality for surgery. Extended reality contains VR, AR, and MR. First, you need to export 3D surface polygons models for each organs out of the patient's CD or MRI. The deep learning system using cloud AI reconstructed the 3D shape of each organ, tumor, and vessels from patient individual CT. And we are usually using these full HD stereo 3D head-mount display. The head-mount display uses an OLED panel for each eye. It uses two lenses that allow for a wide field of view. And immersion into a VR is a perception of being physically present in a non-physical world into immersive side-by-side view, like a 3D endoscope. So we are integrated this in the actual operative room using the virtual reality. And this head-mount display has 360 degrees of freedom, rotational and positional tracking. This tracking is precise, low latency, and sub-millimeter accurate. So the virtual reality needs three components and three elements: spatial presence and interactive reaction, and immersive anatomy or autonomy. And we are using this system in on-site simulation for young surgeons. They can learn and walk into a patient anatomy before the surgery. So we need an image-guided surgery. We need the tracking instrument and the representation of instruments in patient data sets. And it requires tracking technique and requires registration of patient to data sets. So we can integrate this system into an augmented reality system. AR is an overlay of computer-generated contents of the real world. The augmented content doesn't recognize the physical objects within a real world and environment. So we can have a spatial awareness by using AR. They are not able to respond to one another. And another resolution is the mixed reality. Mixed reality is a merging of real and virtual worlds to produce new environments and visualizations where physical and digital objects coexist and interact in real time. And we can merge and pinch in and out and rotate by using the gesture control by using HoloLens. This system features an internal measurement unit, which includes an accelerometer and a gyroscope and so on, And these holograms are given presence in our in our world by remaining in place as we move about in space. So we can put this data into our operative room. By reconstructing 3D surface polygons of the two most vessels and each organs out of the patient abdominal CT, we registered and overlaid them onto the real world in the operative theater through a HoloLens under the sterilized conditions. The exact location between surgical devices and patient anatomy could be tracked on the pair of mixed reality smart glasses by cellular tracking. This is a hepatectomy for multiple liver metastasis. The gesture controls manipulation by surgeons' hands with surgical gloves was useful for interactive anatomical references of tumors, vessels, position, and sterile environment. And this patient accepted the partial nephrectomy for renal cancer. This procedure can safely preserve renal function and effectively treat malignancy in partial nephrectomy. And this is a spatial perception mapping by using the HoloLens for distal pancreatectomy for pancreatic cancer. We can put these data onto a patient body surface, spatial recognition mapping for a laparoscopic port insertion. We can select the area of the surgical portion of a port insertion. So hand-eye coordination can be applied by using this system. And it is also available for spatial mapping and projection mapping onto the actual location of the open surgery. And this is a distal pancreatectomy. This could support complex procedures with the help of pre- and intraoperative imaging with better visualization of the surgical anatomy and spatial awareness in relation to actual anatomical landmarks. And this is for gastrectomy, a laparoscopic gastrectomy for early gastric cancer. The immersive holographic mixed reality system provides a real-time 3D interactive perspective of the inside of the patient. So inside that MR guiding system is that as the spatial awareness was improved, the clinical usefulness was confirmed by avoiding misunderstanding in difficult cases. The immersive and presence feelings decrease the stress of surgeons and improve the bleeding volume and the operative time, safety, and surgical skill. But there remains these issues: accuracy, occlusion of markers, visibility, and adaptiveness. So this is a summary. Image-guided surgery uses tracking and registration to match patient data sets to patient on OR table. Occlusion issue needs to be solved. It may require intraoperative imaging. Tissue deformation may be a significant problem. A simulation of tissue deformation is still too far. In conclusion, navigation in surgery is already the standard of care for a variety of disciplines. With improved computer technology and advanced information processing, VR, AR, MR navigation will soon be increasingly integrated into surgical routines. XR, VR, AR, MR navigation and the guiding system strengthens the space recognition ability for surgeons. Thank you for attention.